Hello. We previously discussed your condition of hypothyroidism. Now we're going to discuss the medication that will maintain it, which is known as Synthroid, levothyroxine sodium. Synthroid is a synthetic thyroxine hormone. This hormone is also known as T4. The thyroxine is a type of thyroid hormone. This hormone uses the same physiologic effects as the T4 hormone in our bodies. Therefore, the medication can maintain normal T4 levels when a patient has thyroid hormone deficiency. The majority of the Synthroid tablet is absorbed in our jejunum in our upper ileum. These are parts of the gastrointestinal system. Synthroid is absorbed best on an empty stomach, but has decreased absorption when foods such as soybeans are consumed. Therefore, it is recommended not to eat anything 1 hour before taking Synthroid or 1 hour after taking Synthroid. Protein-bound thyroid hormones are what help the distribution of the T4 within Synthroid throughout our body. Many drugs and health conditions affect the binding of thyroid hormones to serum proteins. This is why thyroid should not be combined with many other medications. T4 is eliminated slowly. The major pathway of thyroid hormone metabolism is through sequential deactivation of the thyroid hormone. The liver is the major site at which T4 is released. Additional sites include the kidney or other tissue. Thyroid hormones are primarily eliminated by the kidneys. There is a small portion that reaches the colon and is eliminated in the stool. Potential adverse reactions that you may experience and should immediately report to your doctor include irregular heartbeats, chest pains, shortness of breath, headaches, nervousness, sleeplessness, tremors, weight gain or weight loss, vomiting or diarrhea, fever, heat intolerance, and hives or skin rashes. These conditions should be reported to your primary care provider. It is very important to monitor the adequacy of Synthroid drug therapy. In most cases, TSH levels will be monitored every 6 to 8 weeks once Synthroid is initiated. After the patient is stable and on an appropriate replacement dose, the TSH levels will be monitored every 6 to 12 months. This will ensure the patient is not being overtreated or undertreated. In pediatric patients, it is very important to monitor their TSH levels because pediatric patients could be overtreated and that could result in intellectual development issues and linear growth defects. Overtreatment could result in accelerated bone age or compromised adult stature. In elderly patients, they have an increased prevalence of cardiovascular disease. Therefore, it is important to start Synthroid therapy at less than half of the full replacement dose. Atrial fibrillation is the most common of the arrhythmias observed in Synthroid overtreatment in elderly patients. I have completed my education on Synthroid, also known as levothyroxine sodium. If you have any questions, please feel free to ask.